Welcome, everybody, to this week's Alternative Health Blab. My name is Mike Warren, and I'm with Alternative Health Concepts. As many of you know, we bring you these health blabs every week, and today we have a really cool guest. It's somebody that I'm just now starting to understand what this whole world of naturopathic medicine is. My wife is now using a naturopathic doctor for her primary care physician. And it's just really exciting to me what the options are that we have here in the United States through naturopathic doctors. And it was something that I grew up not knowing anything about. My dad is a veterinarian, and as many of you know, he's my partner in this company. And we kind of grew up with MDs were the only way to go. And they were the only ones that knew anything. Well, lo and behold, there's a lot of really great options out there for us in the whole alternative health world. And one of those is naturopathic medicine. So I'm really excited to have Dr. Erin Kinney with us today as our guest. And before we turn the time over to you real quickly, Dr. Kinney, I just want to give a little shout out about you and a little bit about you, mainly from your website, which we'll get to in a minute. Dr. Kinney's practice is in Annapolis, Maryland, where she's the owner of Care Holistic Health. She's obviously, as I mentioned, a naturopathic doctor, and she received a Bachelor of Arts from Vanderbilt University and is a summa cum laude graduate of the University of Bridgeport College of Naturopathic Medicine. Not only was Dr. Kinney the top of her graduating class, she also earned the Academic Excellence and Outstanding Student Clinician Award chosen by the facility. She's also currently the Vice President of the Maryland Naturopathic Doctors Association, an active member of the American Association of Naturopathic Physicians, and is passionate about spreading awareness about naturopathic medicine. And so with that said, tell us a little bit about yourself, Dr. Kinney. What got you interested in medicine in the first place, and how you gravitated toward naturopathy?
Well, I'd always been interested in medicine. I think from the age of 3 or 4, when someone asked me what I wanted to do, I said I wanted to be a doctor. And for a while growing up, I wanted to be an ER doctor, probably because I loved George Clooney and watched ER and thought that's what it was going to be like. Nice. I went to Vanderbilt. I was pre-med for my first year, and I did a rotation. I shadowed in a hospital. I quickly realized that ER doctors did not get very much sleep, and it was a very stressful environment, and I am someone who needs a lot of sleep, so I decided maybe that wasn't the best idea. I continued along the pre-med track, however. Then I had some of my own personal health issues, which led me to, I was kind of disingenuous with the whole field of medicine. And I ended up being a psychology and a business major. I dropped the pre-med. I was like, you know what? Medicine's not, I don't want to go into this field of medicine. I don't like my MD. I'll get to that story in a little bit. So I graduated with a degree of psychology and business, and I decided to go work in my family business, which was industrial plastic manufacturing. About 6 months after graduation, I slipped into a very steep depression. Was not happy. I had gained about 30 pounds. I went from in college, I was a marathon runner. I was very active, very healthy. And then literally 6 months later, I could not get out of bed. Everything I ate made me bloated. I felt horrible. I was crying all the time. So I went to my general practitioner, who you go to first. And before I could finish saying the word, I think I'm depressed, he had written me a prescription for Wellbutrin and then sent me on my way. And I walked out the door, and my family had never been one where we jumped to medicine. If we had a headache growing up, my mother would say, go drink some water, or maybe you haven't eaten. And so I called another family member who's also a GP, and I said, I trust your judgment. Should I take this Wellbutrin? And she goes, well, I'm surprised he prescribed you that so quickly without asking any family history. You had a relative who did not respond well to that. She's like, I would suggest you go see a therapist first, as a first line for depression. So I went to see a therapist that I knew and had heard good things about. And I kind of told her my story. And she was like, I think you might be well suited to go see this doctor that just moved into town. And he's a different doctor. He is a naturopathic doctor. And I said, oh, I've never heard of that. And she goes, I haven't really either, but we had lunch, and, he described a patient that would be a good fit, and you seem like one. So go see him. So I went to see him. He spent about 2 hours with me, and determined that, when I was in college, I decided to become a vegetarian, thinking it would be very healthy for me. Well, it turns out it was not so healthy for someone who was a marathon runner and under a lot of stress. I basically had depleted my body of, all of the protein building blocks, and I was low in B12. And so he changed my diet and put me on several different supplements. And within 6 weeks, I was back to feeling, like 60% back to myself. A few months later, I was back to normal. And he worked on the physiological part of me, but he also talked to me about the emotional component, and I wasn't happy in my family business. I wasn't happy what I was doing. So, I quit doing that, and I got a job working in DC. I was a headhunter, actually, and I interviewed people all day long. And about 6 months into that, I started realizing that I kept asking people more things about their health issues than about their previous work history. So I would go sit down to my boss. Oh, this woman, she had to leave her last job because her mother had lupus and she had to take care of her mother, and listen to all these symptoms that her mother said. And my boss was like, I don't care about her mother's lupus. And I said, well, I do. So I went and had lunch with a naturopathic doctor that had seen me. And I said, how do I do this? How do I become what you do? And, he told me what I needed to do. And I only had a couple classes to finish. So I took the rest of my pre-med classes, and I embarked on my journey to naturopathic medical school. And and then I, after school, I graduated. I moved to Maryland, where I grew up, and my husband's a chiropractor, so we have a practice together. And so that's kind of my long-winded story about myself.
No, that's awesome. And now I'm getting the echo.
Yeah. Oh no.
So it's not your phone, or not your microphone. So I'll just deal with it. But that brings me to an issue that I kind of touched on in the intro. So many of us aren't tired, right? That's not the right word. I don't know what the right word is I'm looking for, but so many of us go to our doctor and it's just wham, bam, thank you, man. Here's a prescription, and they just are symptom only aware. They just want to treat your initial problem, like your headache or depression or whatever it is, without looking at the underlying issue. And that's what brought me to naturopathic medicine and understanding it. Obviously, we have a website called Alternative Health Concepts, and we're about educating people in alternative ways to help your body heal itself. And we have a supplement that we sell that is called BioPro Plus, which is an immune supplement. It's immune modulator, a bioidentical thymic protein that your body produces, and we've learned the extraction process. So that I was already in this natural world, if you will, of health. But then my wife contracted a pretty serious disease. She got cancer, and with what she learned and what I've learned, she didn't want to go the traditional routes. She talked to a couple doctors, and lo and behold, we found a wonderful naturopath that kind of specializes in this area of oncology, but doing it naturally, and a lot of different therapies and things. And my wife is just doing wonderfully. We had several friends pass away within the last year from cancer, and going through chemo and radiation, and it's just not for everybody. And we caught it real early with her, so we just didn't feel like that was something we wanted to do first, because we saw what it did to people's bodies and just tore it down. And so we really feel fortunate. And then so we do these little blabs every week, and my team said, hey, we got this naturopathic doctor, Dr. Kinney, that and we did an article, or we shared your website on our website. We do that every week. We share some different doctors. And so anyway, that's how we got a hold of you, and just really happy to have you today. And so I'm excited about what you do, because you truly are giving people a natural alternative to their health care, and understanding that the body is what heals itself, not some synthetic drug. So, and I know you have some specialties. Obviously, I know why depression is one of them, because that was something that you had to deal with, and you understood, and it worked for you, and you were able to manage that, and that's wonderful. But one of the other things I want to hit on, because that was one of our subject lines, was gastrointestinal issues. So tell us a little bit about what you do. I'm going to back up before we go into gastrointestinal things. On your website, it says you want to share and spread the word about naturopathic medicine. Yeah. So in a short, couple minutes, tell us what is great about naturopathic medicine and how we all can benefit, whether we have our own MD or not, as almost an addendum to that, how that can help us.
Yeah. So one of the main things that I loved when I first learned about the schooling and the training that naturopathic doctors go through, we're probably one of the only professions that are trained in drug, herb, nutrient interaction. So I get a lot of patients that will come in, they bring in, I tell them to bring all their supplements in. I get people that bring in shopping bags full of healthy supplements that Dr. Oz has told them to take, or the person who works at Whole Foods or whichever, natural food store, in the aisle, and they say, oh, take this for this and take this for this. And while they're natural and they are in the good for you store or the good for you aisle, herbs are very effective and they can be very powerful, and some can have side effects. I mean, drugs were derived from natural herbs. So when people are on medications, especially, you need to talk to someone who's trained in those interactions. I've gotten many people that come in and they're like, here's my list of medications, here's a list of supplements. And I go through it. I'm like, well, this interacts with this. And, this you can't take with this. And so, and literally, and it's not MD's fault. They don't have that training. They're not trained in how herbs work and how, high dose of certain supplements can interact with certain medications. So that's one of the reasons that naturopathic medicine can fit nicely into, if you're someone who's like, well, I have an MD I like, and I have a specialist for this and this, a naturopath can almost be, they can also help with diet and the nutrition aspect that you're not going to get from a medical practice. And where else am I going with this? Does that answer the question? Or
yeah, no, it did actually,
yeah.
And I appreciate that because, we actually have a question over in the side note, and it says, as a psychology major and now alternative healthcare devotee, what do you say to your family and friends and family members who still continue to be use the term brainwashed by MDs in their lives? And I don't know, that might be a little harsh, but we are led to believe from the time we're young, at least in the United States, that the MDs are kind of the mainstay, or they are the only answer to your medical problems. So we do have a little of that, but it is something that's hard to deal with sometimes.
And, I get lots of students who are embarking on their journey and deciding whether they want to go to naturopathic school or they want to go to medical school. And I do tell them, I say, being a naturopathic doctor, it's not always easy. On one hand, tons of people are interested in what we do, and everyone, there's this alternative world that's growing. But on the other hand, there are still some medical doctors and some, who think what we do is quackery, or, that we're not trained adequately. And, I think there are some people that you're not going to be able to change their paradigm, because it's a different way. The way we look at the body is different, because we do truly believe that the body can heal itself, and that when the body has a symptom, the body's trying to get itself back into balance with that symptom. I explain to patients, I'm going to use this as a little prop. If, let's say you have a punching bag. So if this was a punching bag and I punched it this way, it would go this way. If we left it alone, it would eventually come back into center on its own. Now, let's say you get the flu. The flu is going to punch you this way, and you're going to be here. Your body's out of whack. So you have a fever, you're throwing up. All of those symptoms are your body trying to get rid of the flu bug to get you back into balance. So to use another example, let's say you have chronic headaches or migraines. Something is causing you to have these headaches. Your body is trying to tell you with the headaches to get rid of this. So what I do every day is I try to figure out, what is this? How can we remove it so the body can heal itself on its own? What medical doctors, what the allopathic mindset is they see the symptom and they say, oh, we've got a medication that will punch you this way, take the headache away, but now you may have a side effect from that drug. So now you're here. Then you may need another medication to punch you this way, and then you're back over here again. And before you know it, your body can't get itself back into balance because it's being punched in all these different directions by different medications. So the way we look at the body is a little bit different. So to answer your question in the sidebar, you can just try to explain to them as best you can what you do. But some people, as I said, they're not going to be able to see outside of their own paradigm. And, I think that's part of the work when you're in this medicine. You just have to learn to kind of let that go. Because it can be frustrating that, and I've had patients that, they go see their MD and their MD says that they're crazy for coming to see, someone like myself. I also have a group of patients who lovingly call me their witch doctor. And so we're all better, and they send me, they refer people. So,
if it works, go with it, right?
Exactly.
That's awesome. Okay, so let's get back to where we were kind of headed with the gastrointestinal thing. Mm-hmm. What do you guys do different than say the traditional? That we hear so much now about leaky gut and all these different things, and that our gastrointestinal system, our gut is actually 80 to 90. I've heard as high as 95% of our immune system. I don't know about that, but I know it's a good percentage goes on within our gut.
Well, one of the first things that we learn in naturopathic school is kind of all starts with the gut. I mean, that old saying, you are what you eat, it's not really true. It's you are what you absorb. So if the brush border in your intestinal lining is not healthy and it's not actually absorbing nutrients, you can eat all the good food you want, but if you're not absorbing the right things, you still can be unhealthy. So most patients that come in, whether or not they're coming in for a specific GI complaint, they will leave with some sort of protocol that's working on their GI tract. And the way that we do things a little bit differently, I ask a lot of questions about bowel movements, and, I've got a lot of kids who call me the poop doctor because I always want to know, how does your poop look? How many times did you go? What does it look like? What's in there? And some kids like it, some get embarrassed about it. But that's a really good marker of your health. And it's not just how often you go, it is. What's the consistency? How thick is it? What color is it? Is there blood? Is there mucus? Is there undigested food? So all of those things kind of tell us how the GI tract is functioning. Now, some people can have no GI symptoms. Their stools look normal, but the body is kind of compensating, and maybe they're having symptoms elsewhere, but the root cause of it is still in the GI tract. So I do a lot of food sensitivity testing. I do a lot of specialty diets. Everyone leaves with a diet that's highly tailored to them. There's no one diet that fits all, especially when, we're starting to talk about leaky gut. I do a lot of testing, which will test, it doesn't per se test for leaky gut, but if someone comes back with they're sensitive to 20 plus foods and it's all the foods they're eating all the time, they're essentially becoming reactive to things that they eat, which means they have the leaky gut. And so in that case, they're going to need to be on a diet that removes all of those foods.
When you talk about diet nutrition today, because we hear so many different things going on, and it sounds like what you said is, I believe at least, that there is no one diet for everybody. Vegetarian doesn't work. But what I have heard, and maybe it because of what my wife's going through, is that you need a very heavily plant-based diet to begin with, and as much natural, organic, fresh fruits and vegetables.
One thing that I will say is that if you can buy organic. I tell patients that, fruits and vegetables, especially the stuff that they spray on fruits and vegetables, it's toxic to your body. And it's destroying a lot, like, wheat. I see so many people that are sensitive to wheat now. I think 50 years ago, they probably would not have been sensitive to wheat, but they spray Roundup and the organophosphates that they use on the wheat. Literally, when that gets into your body, it talks to our genetics, it talks to our biofilms, all of our good guy probiotics, and it changes that environment. And when we change the environment in the GI system, it changes the pH. When we change the pH, we're going to throw off all of the flora. And when the flora gets disrupted, that's when it starts to disrupt our immune system. So really the root cause to our health is what we put in our body. So buying organic fruits and vegetables is extremely important. And then when you get into the proteins and meats, hormone-free and antibiotic-free, it's also important. I mean, when we start to get into the hormone realm of things, if you're eating, even if you're just eating a little bit of red meat, once or twice a week, but it's pumped full of estrogen, the cow is, then you're getting that. That's if you're a woman, you're getting that extra, or if you're a man, you're getting that estrogen, which you don't need, or you're a 12-year-old girl who, shouldn't be getting her period and has, started to do that. So, it's very important to buy, if you can buy local, I encourage a lot of our patients to go, hey, Maryland, there's tons of farms here. Go find a farm, buy a quarter of a cow, put it in your freezer, and at least exactly what was done to that cow and what was put in it and what it was fed. So yeah, diet is 80% of the battle when it comes to healing your gut and treating different GI issues. And I think that's another way that we differ from MDs. I treat a lot of ulcerative colitis and Crohn's disease, and I can't tell you how many patients I come in and I say, well, what did your MD tell you about diet? Oh, they told me I didn't really need to change my diet. They said I could go see a dietitian if I needed to, but they said diet really wasn't any of the cause. It's an immune system issue. It's not. And I just laugh. And,
wow.
And again, it's not their fault. They weren't trained in that. They were trained to look at the symptoms and to treat the symptoms. So, I have a lot of family members that are MDs, and back to that question before, they were trained in a different paradigm. So it's like Christopher Columbus or whoever thought the world was flat. That's what they thought. That was all they knew. They didn't know the world was round. So,
to me, that's the one kind of saving grace to this whole. If you look at it as a problem with the allopathic MDs thinking that they're the only way to go, that's the beauty about this, about science itself, is that it's ever changing.
Oh, yeah.
And it's obvious when people keep having the same results and we're getting sicker and sicker as a nation that something's not quite right with the current model. And I think that's where naturopathic medicine, chiropractic medicine, all these other different modalities are ways that are going to help change that or shift it back.
Yeah.
Long before the traditional MDs that we have of today, even just 150 years ago, it wasn't like it is today. It was done with herbs and different tinctures and different things that are produced from nature. That was our medicine.
Yeah.
Just even 150 years ago. You don't have to go back hardly at all. And it was that way for thousands of years before. So there's something to it.
Oh, yeah.
And hopefully we can change it back. So when somebody comes into your office, a new patient, it sounds like almost no matter what the problem is, you're going to initially look at nutrition first.
Oh, yeah.
Because okay. So that would be the first thing you look at.
Mm-hmm. And I get, there's kind of two categories of patients that I get. I get a category of patient who they already know a lot about alternative medicine and they're coming, they just kind of want a guide, to make sure they're taking all the right things. And they usually, their diet is kind of on point. We just tweak a couple of things. The other type of patient that I get is someone who's been failed by the medical system. They've been to see doctor after doctor after doctor. They've had a diagnosis. Maybe it's the right, maybe it's the wrong one, and they still don't feel better. They're on medications, their doctor has said, we've done all we can do. And, and they don't believe that. And so they come in, and they're usually the ones that they didn't know that diet could make a difference. And so, and they're usually, they come back 3 weeks later and I tweak their diet a little bit and they say, oh my gosh, I feel so much better. And they're like, I never knew taking dairy out of my diet could make my joint pain go away, or something, something simple like that.
So there's another question. Not everyone can find or afford naturopathic or have a naturopath to prescribe a diet. What are ways, I think they meant to say, included in a diet designed to improve a person's immune system? So what are some of the main things that kind of can help? I mean, as you already said, not everybody's the same. And
not everybody's the same. I mean, the one big thing that I usually tell most people, or the two big things, gluten and dairy are the big things that I tell people to get off of. Certain people can tolerate dairy to a small extent, but dairy is very inflammatory and it's going to cause the body to produce mucus. So when we're talking about an immune system issue, getting off of dairy is going to immediately, it's like taking away, a 50-pound weight that the person has to carry. It's just going to lighten the load a little bit. And then gluten, as I said before, everything that they spray on the wheat today is so toxic. And I've seen removing gluten from people's diet do everything from, fix some stomach pain to removing headaches, removing joint pain. I mean, I've seen removing gluten do some weird things, helping ADD in a child. So, and in terms of the immune system, yes, especially in autoimmune conditions, gluten is a big no-no. So those are the two things that I usually recommend people discontinue on kind of a broad spectrum. But then when we get into more of the specified thing, I trained with Dr. Peter Diadamo, who wrote the blood type diet, and I kind of used that diet guideline as my starting point for each patient. Again, everyone's a little bit different, but if someone who's blood type O is going to walk away with a very different, diet regimen than someone who's blood type A. So if that is, and that's something you can look up on the web. The diadamo.com is all the information about the blood type diet. It's really interesting. Each blood type has a different immune system. It functions a little bit differently. So certain foods are beneficial and certain foods aren't beneficial depending on the blood type.
Interesting. So you obviously would do blood testing of your patients to understand that, if that's what you do.
We can do a simple, it's a simple finger prick to do the blood type testing in the office if someone doesn't know their blood type, which most people actually don't know unless they're a donor, or unless they've had a child. They normally don't test it, but it can be it gives us valuable information.
So this is literally just based on the type of blood, not your blood marker?
O, A, B, yeah.
Oh, wow. That's amazing. I've never heard of that. That's interesting.
Yeah, it's a really interesting. Eat Right for Your Blood Type is the name of the book.
Interesting. Okay, what about, because we hear so much today, and gluten is a big part of it because the way it transfers into your body, all the wheat products and the grains. But what about sugar itself?
Sugar. Sugar is a big no-no. Sugar in its natural form, a little bit of fruit sugar, not going to be too damaging, but sugar is kind of, especially when we're talking about, someone like your wife who suffered from cancer, sugar feeds cancer cells. It itself causes inflammation. So if you're someone who has an immune system issue or inflammation is running high, getting off of sugar is also going to be really important. And
isn't it true, doctor, that the bad bacteria that we all have in our guts, and many of us are overrun with that, isn't, for the most part, sugar what feeds the bad bacteria in our gut also?
Sugar can do that, yes.
It can. It's not necessarily for sure, but
it will feed. But I think it will feed certain bad bacteria, but it also, when inflammation is high in the body, it goes back to changing that terrain, as we call it, or changing the pH. And when we change the pH, that allows, the wrong type of flora to grow. So we want to keep the pH. The pH of the body is usually very, very tightly aligned around 7.4. But if there is inflammation, that pH can go up or can go down. And that's when that environment changes and those bugs can, the good guys can flourish or the bad guys can flourish. So sugar kind of hits you on a two-pronged attack when you eat it. It feeds the bad guys, and it also creates an environment for the bad guys to grow even more.
Interesting. So that is a big thing. So you got sugar, gluten. So you're not saying all grains. We happen to have gone off all grains, and I'm kind of doing what my wife did with hers. But for the most part, wheat, barley, all the gluten, gluten grains.
This goes back to varying, each person's a little bit different. Some people don't tolerate grains at all. There are other people that, they can have a little bit of gluten here and there, or they can, they do fine with oats, they do fine with rice, they do fine with other grains. So that again goes back to each individual person. And it also depends, when it comes to, working with a patient to get better, I have some patients who are very, very opposed to changing their diet. It's very difficult for them. And, they miss certain foods. And when food is a part of your culture and it's a part of your, there's an emotional component there. So, and I don't like to underestimate how that can also impact the body, because that if it's too stressful to be on a very strict diet, that stress can negatively impact, that can cause inflammation to go up. And so, some patients, I'll say, if it's too difficult for you to go 100%, you can still have, whichever food this is once a week or twice a week. But again, that depends on the case. If someone is, if changing their diet is extremely difficult for them.
I want to ask you another question, kind of goes along with that. So in your practice in naturopathic medicine, if somebody's looking at that, most of us are used to going to an MD. If I got a severe headache or high blood pressure or whatever the case may be, I'm going to get a prescription. And in most cases, that's going to fix the symptom very quickly. Mm-hmm. The drug will. And like you mentioned with your great analogy, at the same time, we're going to be tilting our body one way or the other because of that drug. It's going to take care of that symptom, but it might cause another problem somewhere else in our body.
Yes.
In naturopathic medicine, do you find that the herbs you use or the supplements that you recommend, do they have that same kind of quick effect, like get well quick, or does it take longer for people?
In some cases, people come back and they get well very quickly. When you're looking at, like, if someone comes in and they've been dealing with a condition for 10 plus years, I tell them, you're not going to get better overnight. It took 10 years for your body to get to this place. We're not going to undo all of that in a week or a month or even a year. Maybe it might take a little longer. Someone who has a more acute problem, they were, just diagnosed 6 months ago with, GERD, or they, were just diagnosed with Crohn's, and it also depends on the age of the person, how strong their vital force is. I usually find in children respond to this medicine very quickly. They'll come in, I change their diet, I put them on a couple supplements. They're better in a month. And the mom's like, I don't need to come back. I'm like, great.
Awesome.
Other people, if they're older and, as I said, they've been dealing with a condition for a long time, it's not going to happen overnight. And I tell them, I say, I have had cases where it's been amazing and people come back 3 weeks later and they're like, I feel like a changed person. And, but I say don't expect that, this isn't easy. But in the long run, we're helping your body heal itself. So
Sure.
it's not, we're not causing another symptom that you're going to have to deal with down the line.
You mentioned supplements, and early on in our blab today, I mentioned that we have a good supplement that is a bioidentical supplement that is produced in our body. It's a protein that's produced in our body. What kind of supplements do you use in your practice when you talk about supplements?
Are you talking about brands or?
Well, not necessarily brands, but are they vitamins? Are they minerals?
I use a lot of herbs. I use a lot of vitamins. I use, excuse me for 1 second.
No problem.
What do you need? Yes.
My briefcase.
Sorry about that.
No problem.
So yeah, it's either vitamins or herbal medicine. I also use homeopathics, which is a whole other topic that we can talk about at another time.
Sure.
But yeah, those are mostly just vitamins and herbs.
Okay, great. So and again, it's all geared to helping your body heal itself. Mm-hmm. And that's what your job is as a naturopath, is to look at that person, understand what they're going through, and understand what type of supplement, what type of herb, what type of nutritional program they need to be on, and then coach them through that. The one thing that I can tell you that you didn't say, and I'll brag about your profession a little bit because I'm new to it with what my wife went through. The first appointment we went to, we were literally in this gal's office. She happens to be a lady also. Mm-hmm. And we were there for 2.5 hours.
Oh yeah.
And I thought, I haven't spent, in my 57 years on earth, I haven't spent 2.5 hours with a doctor the whole time. I go in and I see the doctor for 5 minutes if I'm lucky, and I'm out the door. I couldn't believe the difference. It was just night and day.
Oh yeah. Yeah. So that we practice differently. I mean, you can't get to know someone's vital force or how someone's body is going to react in 5 minutes. I mean, so we take a very detailed history. And then part of our medicine is I like to teach my patients why they're taking everything or why they're changing their diet or what's actually going on in their body. I get a lot of patients that will come in with, they'll have a thyroid condition called Hashimoto's. They don't understand what that means. They have no idea what the lab tests mean. They just know, oh, this number was high, so that means that's bad, or this is good. So I explain to them. I draw a lot of pictures. I have whiteboards everywhere in my office. And so that when they leave the office, they feel like they have more of a control on their own health condition. And they understand why they're taking everything that they're taking, which leads to better compliance because they understand and they feel like they're more in charge of their own health.
Yeah, absolutely. That's a huge deal because if they feel like they are in control and not just some doctor writing a prescription, that becomes almost a hopeless or a helpless feeling when you're at the total whim of somebody else.
Yeah.
It's scary. It can be downright scary, especially if you're facing a chronic disease, to throw all your trust in one person, possibly your life.
Yeah.
It can be very, very scary. Whereas I love that concept of you're empowering the patient to take control and heal themselves. Mm-hmm. And that's exactly what our philosophy is at Alternative Health Concepts. I know we've reached 12:45 on my time. I guess it's is that 3:45 your time?
Yeah, that's
Right.
okay.
And you need to go. I know that you've got a patient and you're waiting to see you. And so I wanted to thank you. We're going to cut it a little short today, but thank you for being here. Really, really appreciate it, Dr. Kinney.
Well, thank you for having me.
I always give the final parting word to you guys. If you would like to say anything and finish up and wrap it up for us.
Well, I just say, if people have questions about naturopathic medicine, please go and visit the American Association of Naturopathic Physicians. There's a wealth of information on there about how we practice our principles, kind of our philosophy. There's also a good section you can find a naturopathic doctor near you. You type in your zip code and it'll pump out all the different docs that are around. So I recommend that. And, as I said, I love spreading awareness about this medicine. So thank you again, Mike, for having me and letting me talk about it.
It was our pleasure. And again, I concur with everything you just said. I have found it just amazing. And it's been so beneficial to our family in the short time that we've been going to a naturopath. I really am excited about it. And I think you guys are just doing a great job. Keep up the good work.
Oh, well,
and let's all spread the word together.
Yeah. So, all right. Sounds good. Take care.
Thank you so much. Bye. Appreciate it. Bye-bye.